Did you know that about 50% of women will experience heart palpitations as a sign or symptom of perimenopause, and they don't know exactly what's going on? Yes, about 50% of women will experience this, but although it's a common symptom for perimenopause, it is actually a lesser known symptom of perimenopause because people are having heart palpitations but not correlating it back to actually a sign or symptom of perimenopause. Hi, I'm Dr. Stephanie Young Moss. I am a pharmacist and menopause educator, and I'm the founder of Menopause in Color. And today we are going to talk about perimenopause and heart palpitations. Now, I got this question a lot in my inbox. People are asking, what are heart palpitations? Why am I having them? And why is it accompanying my perimenopause and menopause? So we're going to talk about that today. First, let's understand exactly what is a heart palpitation. This is any sensation that you are feeling in your chest area, typically in the heart area, where it may be either a rapid heartbeat or just a regular type of heartbeat. Typically, it can even accompany hot flashes. It can accompany if you're having anxiety as well. So if people are feeling hot flashes and they feel as though they feel a sensation of heat coming on, which is actually the most common sign or symptom of perimenopause, sometimes a heart palpitation can accompany this. And this is when people are actually worried about what they are experiencing at this time. Now, heart palpitations can come about because when estrogen levels are declining or decreasing, this actually affects your heart. Estrogen receptors are all over the body. So when your estrogen levels are decreasing, this actually affects the electrical system and also the muscle of your heart. And this is why you're feeling that heart palpitations. So why are heart palpitations seen with perimenopause and menopause? Well, this is because you have estrogen receptors all over the body. And those receptors actually help regulate your heartbeat, and it also controls the pathway through which the electrical systems or the electrical signals travel for the heart. So when you have those decline in those estrogen levels, this will actually affect your heart rate. And low estrogen levels can actually put stress on the heart, and that's why you have those heart palpitations as well. So low estrogen levels can actually overstimulate the heart and make it beat more. And this is why a lot of times you will experience or feel heart palpitations during perimenopause. Of course, when you're first experiencing heart palpitations, it can be very scary if you have not experienced it before. So many women are not sure what's going on. So it's important to talk to your healthcare provider if they do concern you. Now, while heart palpitations during perimenopause and menopause can be normal, sometimes it can be a cause for concern. So that's why it's important to talk to your healthcare professional. Now, dealing with heart palpitations and feeling them, especially for the first time, can be very alarming and scary. So when should you seek help? If you are experiencing heart palpitations for longer than several minutes, if you have chest pain, shortness of breath, if you're sweating profusely, or even if you have, if they become frequent or worse over time, and if you've started hormone therapy and you have seen an improvement, however, if they continue to get worse over the next 3 months, this is the time when you really should talk to your healthcare professional because there could be something else going on. So heart palpitations was one of the first signs that I saw in perimenopause, and I had no idea what was going on. I went to my healthcare professional and I talked to them, and they actually sent me to a cardiologist. Once I went to the cardiologist and received, everything was fine with my heart. No one ever talked to me about it possibly being perimenopause. So it's important to make sure that you have someone that is knowledgeable with perimenopause and menopause, and that they can help you with things that you can do with heart palpitations, or at least things that you can try and do as far as lifestyle changes, or what are your options as far as when it comes to heart palpitations. Now, what can you do when it comes to heart palpitations and managing those things? Of course, talk to your healthcare professional to see what's best for you, because everyone's medical history is different. But it's important to make sure you're looking at your diet. What are you eating? What types of things are you eating? Do you have all of the nutrients that you should be having? How are your magnesium levels? How are your vitamin D levels? Especially those magnesium levels, because it does help with this as well. So once you have determined that your heart palpitations is actually linked to perimenopause and low estrogen levels, there are a few things that you can do. First, you can talk to your healthcare professional about hormone therapy and decide if that's right for you, because hormone therapy actually will help with heart palpitations and other things that are associated with your cardiovascular system. Because estrogen is cardioprotective, it does help with things like lowering your cholesterol. It also helps with alleviating heart palpitations. But if you know that hormone therapy is not right for you, or if you have other medical reasons why you cannot take it, there are other things that you can do. First would be to make sure that you maintain a healthy diet. What do your vitamins and nutrients look like, especially your magnesium, because the magnesium really helps with the heart, and it helps with maintaining and help with your heart palpitations as well. Make sure that you are maintaining a healthy diet. Are you increasing your whole grains, your fruits, your veggies, eating lean meats? That's always helpful. But you can also try and eliminate certain things in your diet, especially things like caffeine. Caffeine can actually cause heart palpitations if you are sensitive to it. So look at that. What do your caffeine levels look like? How much coffee are you drinking? Are there things that you can do as far as decreasing the amount of caffeine that you take if you just can't live without coffee or caffeine? So what I did was I actually started switching to a half caff. So I cut my caffeine in half. And then from there, if you decide you want to take it out your diet, then wean yourself off, simply going from half caff to decaf to cutting it all the way out. That is an option. Or you can just limit the amount of caffeine that you take, going from 1 cup a day to 1 cup a week or a couple of times a week. Sometimes that can help as well when you're trying to eliminate that caffeine. Things such as sugar and also alcohol are things that we don't think about that can also cause heart palpitations. So when you add that onto already having your estrogen levels low, which causes heart palpitations, these are things that you need to consider when you're trying to help with heart palpitations. Another thing you can do is make sure that you're managing your stress. Of course, we know stress and anxiety can contribute to heart palpitations and making you feel nervous, especially if you have rough situations at work or at home. Try and manage those things. Try and be mindful of what's going on and what situations you're in and what's going on in your home or in your job. Try and manage those stress. I know a lot of times that can sound a lot easier in fairy tale. However, try and be mindful of what kind of stressful situations that you're in, and try and reduce some of those things to make sure that you're doing the right thing as far as alleviating and decreasing the amount of heart palpitations that you're getting. Did you know that dehydration can also contribute to heart palpitations? So if you are dehydrating, this is also putting a strain on your heart and causing heart palpitations. So make sure you're drinking water. Make sure that you're drinking enough water throughout the day to help with those heart palpitations as well. Monitoring your sleep patterns is also very important. Of course, we know that when you are in perimenopause and menopause, you may not sleep as well. This can put stress on your body and also on your heart. So make sure that you are getting enough sleep, whether it's going to sleep earlier, make sure that you're trying to sleep throughout the day. And there are supplements that can help, sleep throughout the night. There are supplements, of course, that can help you get to sleep, like magnesium. There are certain magnesiums, and I do have a video that talks about different types of magnesiums and which one can help, so check out that video. But these are some of the things that you can do to try and help manage those heart palpitations. So I have mentioned some supplements that are natural besides hormone therapy that can help with heart palpitations, but here are a few more that we can talk about. Now, we talked about magnesium. Magnesium is very important when it comes to your overall system and with other perimenopause signs and symptoms. But with heart palpitations, the magnesium citrate and also magnesium taurate, those are two that actually help with heart palpitations if you are experiencing them and you know that it is attributed to perimenopause and not anything else. Those two actually help because they do help with the cardiovascular system. If you don't want to take supplementation, you can also reach for foods that are rich in magnesium, such as seeds, nuts, green leafy foods, and vegetables are very important. They all have great magnesium levels in them as well. Another supplement that's very important that can be helpful are omega-3 oils. Those supplements and fish oils are very important, and they will actually help with your heart. They help with lowering cholesterol, and they also help with heart palpitations. They have anti-inflammatory properties that actually help with heart palpitation and heart rhythm as well. Vitamin B complex, especially vitamin B6 and B12. These have been shown to help with nerve function and also with heart palpitations. They also help with maintaining overall cardiovascular health as well. Again, when it comes to heart palpitations, this is also very scary when you're not sure exactly what's going on with you. So it's important to talk to your healthcare professional if you're experiencing this to rule out anything else. Make sure that you stay informed about what's going on with your body. Make sure that you're reading all the signs and symptoms if you're experiencing heart palpitation. Make sure that you're not being ignored if you're very concerned. But look at your diet. Look at what you're doing with your lifestyle. See what changes you can make, what supplements that will work with your medical history, and talk to your healthcare professional before you start any other supplements, vitamins, or anything of that nature. But talk about your options and just make sure that you're being heard. I want to make sure that you guys stay informed about different signs and symptoms and different vitamins, whether it's supplements and even hormone therapy that can help with signs and symptoms of perimenopause and menopause. Once again, I'm Dr. Stephanie Young Moss, and I am the founder of Menopause in Color. I thank you for joining me on this channel. Please feel free to like, share, and subscribe. I appreciate your support. It is so helpful with getting the content out there and helping others to stay informed. Feel free to join our private Facebook group, Menopause in Color, where we talk about all things perimenopause and menopause. And I look forward to coming to you into another video. If you have any questions or if you have any concerns or just comments of how you have managed heart palpitations, feel free to put them below so that we can discuss it. Thank you again and have a great day.